biggest thing is stay active. An object in motion stays in motion.
Welcome to the Homepage Network. I'm Sarah Vogt. To meet our community's growing needs, the Laurel Health Centers chiropractic team is growing too. Join us as we welcome Dr. Sarah Taylor to the Laurel Health family and learn more about how we can improve our mobility, better manage pain, and maintain our bone and joint health as we age. Dr. Taylor, welcome to the area.
Good morning, thank you.
Well, can you tell us a little bit about yourself? What first drew you to the field of medicine?
All right. I'm actually from the Troy area. When I was in high school, I was a two-sport athlete who was chronically battling injuries. And through my interactions working with athletic trainers, physical therapists, I knew I wanted to work in healthcare in some kind of capacity. I just wasn't sure what. So I took up kinesiology at Penn State. And that's the study of the movements of the body, because that was going to give me the background knowledge to go kind of any route in medicine, because I knew that I wanted to be able to give back to my community in the same way that those athletic trainers, physical therapists, and medical providers had helped me.
I think it's comforting for most of us to go to a provider who understands our pain and our struggles as we do the physical things on a daily basis.
I absolutely agree. It helps us from a provider standpoint to be more empathetic to our patients. We've been there, we've been through those same struggles, and I think it humanizes us so that way we're right there with you.
Why chiropractic medicine? What inspired you to pursue this area of medicine?
When I first graduated from Penn State, I had no idea what I wanted to do. I still knew I wanted to do healthcare in some capacity. I just really wasn't quite sure what. So I took a year off and I worked as a personal trainer and a physical therapy tech. I wanted to get my feet wet. I wanted to work with patients and really just start interacting with them until I knew what I wanted to do. And in doing so, while I was working as a physical therapy tech, one of my patients came in that I was working with, and he asked me, do you like your job? I said, yes, I love my job. He asked, is this what you want to do the rest of your life? And I said, no, I just really was kind of stuck. And until I figured it out, I was going to do that. And he was a local chiropractor, and he asked me if I would ever consider chiropractic. And to me, chiropractic was new. I grew up in a very medically based home. I'd never been to a chiropractor. I really didn't know anything about it. So every time he came in for treatments, he would educate me. So I'm taking him through his exercises, and he's teaching me about chiropractic, about what it is, what it treats, how it works. And in this exchange between working with him and him educating me, I actually fell in love with the idea of chiropractic. So I shadowed with his office. He became a huge mentor to me. And 2 months later, I was sitting in my very first chiropractic class.
So what types of problems can a chiropractor help us with?
Chiropractors really help with a boatload of different problems. Traditionally, neck pain, mid-back, low back pain, sciatica, headaches. They can also help with different myofascial injuries, meaning the muscles or the tendons in your body. And we do that through a variety of treatments. Namely, the biggest one would probably be the chiropractic adjustment, which is applying a specialized force through those segments. But we also offer myofascial release, which is, again, getting in and working those muscles to loosen those up to help provide pain relief and help improve range of motion and posture.
How can we be proactive protecting our spine and joint health?
I would say the biggest thing is stay active. An object in motion stays in motion. So the better off your body is in terms of staying active, staying healthy, that's really going to protect. It's going to help improve your range of motion. It's going to help keep those fibers and muscle structures lengthened. Also doing your regular, proper lifting techniques, proper sitting and sleep hygiene type techniques, they're really going to help in addition to good diet and exercise.
Dr. Taylor, thank you for returning to your neck of the woods back here in Tioga County to help those of us who need to keep moving, even though we might be experiencing pain.
Thank you for having me. It's been such a pleasure getting started back over in this area and joining the Laurel Health team.
Are you suffering from neck, back, or joint pain? The Laurel Health Centers have you covered. To make an appointment with Dr. Sarah Taylor, call 570-662-2002 and visit laurelhc.org to learn more about Laurel Health's cutting-edge chiropractic techniques and whole person approach to care. Thanks for joining us today on the Homepage Network.
The Mansfield Laurel Health Center is now accepting patients in the state-of-the-art Susquehanna Health Medical Plaza at Mansfield. In the same facility, Susquehanna Health is offering physical and aquatic therapy, imaging, laboratory, cardiology, and sports medicine services. For more than 40 years, our 6 Laurel Health Centers have provided high-quality, compassionate care to the residents of Tioga County, offering family-based primary care services, obstetrics, pediatrics, preventive screenings, and diabetes education, as well as outpatient counseling and therapy services. Our passion is to provide comprehensive health care to all who need it with dignity and respect.